Hello everyone, am I audible and visible? Let me know. Am I audible and visible? Let me know, then we'll start. Okay. I think I'm audible and visible. Okay, fine. Hello everyone, I'm myself Dr. Deepthi Karya. I'm a PhD Physiology and I'm your educator for physiology. Okay. Today we'll discuss about clinical aspects and some applied aspect of stomach. In last class we have discussed about peptic ulcer and today we will discuss about vomiting as well as gastrectomy and the consequences of gastrectomy. And in next class we will discuss about gastric function test. Before starting my class, I would like to inform you all that all of you will get my notes in soft copy as well as hard copy. To get the soft copy, you have to download the application Basilius and subscribe for the same. And for the hard copy, you have to get my notes, physiology notes. That is my book that is available on Flipkart as well as Amazon. Okay, link for all that is given in the description box. As well as you can join us on our WhatsApp number, that is 78638 22668. Okay, either you can join the WhatsApp number or you can join the WhatsApp group for which the link is given in the description box. Okay, now let us start our today's topic, that is applied aspect and clinical aspects of the stomach. Here today we'll discuss, in last class as I told you we have discussed about peptic ulcer. Today we'll discuss about physiology of vomiting and gastrectomy, and in next class we will discuss about gastric function test. So starting with today's topic, that is vomiting or emesis. What is vomiting or emesis? That is forceful, it may be asked as a short note. It is forceful expulsion of the content from stomach or sometimes from upper intestine. Stomach or upper intestine through mouth, that is vomiting. Fine. Now initiation of vomiting, that is by two ways. Number one, either activation of vomiting centers or activation of another center, that is chemoreceptor trigger zone. We will discuss one by one. Now activation of vomiting center, these are the vomiting centers. These vomiting centers, they are located in the reticular formation of medulla oblongata near the vagus nucleus. Medulla oblongata near the vagus nucleus. And direct activation of vomiting center, that is either because of injury to this vomiting center or maybe because of increase in the intracranial pressure. Afferent impulses are transmitted and they activate the vomiting center. Either afferent impulses from visceral fibers, visceral afferent impulses, either sympathetic or vagus nerve, okay, or afferent impulses from vestibular nuclei and vestibular apparatus. Commonly, that is in cases of motion sickness, impulses are transmitted. Okay, or afferent impulses from higher centers like diencephalon and limbic system. For example, nauseating smell, seeking sight, fear, previous memory of nauseating, any other thing that also initiates and stimulate this vomiting centers. Okay, then another, that is activation of chemoreceptor trigger zone. This one, chemoreceptor trigger zone, that is present in the floor of fourth ventricle, that is in or near the area postrema on the medulla oblongata. This is V-shaped band of tissue that is located in the lateral wall of the fourth ventricle, and this part is chemoreceptor trigger zone that lies outside the blood-brain barrier, and therefore it is permeable to many substances which cannot cross the blood-brain barrier. Okay. Another important thing is it contains D2 receptors and also 5-hydroxytryptamine receptors. So this agonist also can stimulate. Another, they are also stimulated by circulating emetic agents, emetic substances. Okay, like the person is, if he or she is having uremia, or after radiation, you can say radiotherapy, chemotherapy, they also stimulate this chemoreceptor trigger zone. Also circulating emetic agents like apomorphine, emetin, digitalis, okay, glucosides, they all stimulate this chemoreceptor trigger zone. Okay. Now, efferent impulses, they are from the chemoreceptor trigger zone. You can see these are all the afferent, and efferent fibers, they pass through nerves which are 5, 7, 9, 10, and 12 cranial nerves. Through this, all nerves impulses are transmitted, okay, to the upper digestive tract, and through spinal nerve to the muscles of respiration. You can see here upper digestive tract through 5, 7, 9, 10, and 12, and and respiratory tract through the spinal nerves. Fine. Now, now we discuss about sequences of event during vomiting. First, that is nausea. What is nausea? That is the experience before actual act of vomiting. There is increase in the salivary secretion. The person is having deep, irregular, and rapid breathing before vomiting started. Then pre-ejection phase. Pre-ejection phase means here before the ejection of the content, the person is having relaxation of the stomach, gastric relaxation, and retroperistalsis they start. Retroperistalsis means peristaltic waves in the opposite direction. Normally peristaltic waves are in aboral direction. Aboral direction means away from the oral cavity. Okay, but here now towards oral cavity they are reverse peristaltic waves. Okay, another is next that is retching phase. Retching phase, here what happens, there is closure of glottis. Glottis gets closed here. That is to, it is not shown properly in this diagram. Closure of glottis but not properly seen. So glottis gets closed till the end of vomiting. Why? Because it is to prevent aspiration of the vomiting content into the trachea, and there is rhythmic action of respiratory muscles, contraction of abdominal and intercostal muscles, and diaphragmatic muscles also. Okay. Next is ejection phase. Here what happens during ejection phase, closure of glottis is continuous. Then pyloric part of the stomach, here it contracts firmly, and contents of the pyloric part, they are transferred in body part. Okay, and simultaneously there is intense contraction of the abdominal muscles. Here abdominal muscles, they also contract, and they increase intra abdominal pressure, and because of increase in the intra abdominal pressure, all the contents, they are squeezed out of the stomach into the esophagus. Now they are coming in the esophagus. Okay, from the esophagus these contents are expelled into the mouth due to positive intra pulmonary pressure, as well as, that is one cause, positive intra pulmonary pressure. And second cause, that is because of anti-peristaltic waves. Anti-peristaltic waves. Okay, soft palate is raised here because to shut the nasal cavity. Okay, so this is all about the act of vomiting and centers. Okay, now next topic, next clinical aspect we will discuss, that is total gastrectomy. Total gastrectomy means, here you can see the stomach is totally removed, and you can see here there is anastomosis made between esophagus and the jejunum, and this duodenal part is also, that is sutured. Okay, what are the indications for total gastrectomy? One of the indication, that is carcinoma of stomach. Okay, partial gastrectomy is performed as a part of bariatric surgery. Bariatric surgery, that is to reduce the weight. Okay, because if stomach and initial part of the intestine, they are removed, then decrease, you can say that amount of the food taken by the individual is reduced, as well as absorption is also reduced, and that results in weight loss as well as other consequences due to weight, like diabetes mellitus and blood pressure, they are also reduced along with decrease in the weight. Okay, but what are the effects of gastrectomy? Okay, there are nutritional disturbances. What are the nutritional disturbances? One, that is effect on the carbohydrate metabolism. Immediately after person takes food, what happens? There is hyperglycemia. Okay, sugar level increases, and followed by hypoglycemia. Why? Because the food immediately from esophagus reaches to the intestine, so after taking food all the glucose is absorbed, so the person is having hyperglycemia, and after 2 to 3 years, because there is no food, and that results in hypoglycemia. Okay, there is effect on the protein metabolism, absence of pepsin, so protein metabolism is affected. Effect on the fat metabolism, fat absorption is also affected a little bit, because if along with the stomach, intestine is also removed. Okay, vitamin B12 absorption is markedly affected, because for vitamin B12 absorption we require intrinsic factor. So there is deficiency of intrinsic factor, and that results in decrease in the absorption of vitamin B12. Along with that, effect on the absorption of iron, because iron absorption is highest when iron is in Fe+2 form, ferrous form, and this ferrous form that requires HCl, and HCl secretion is there in the stomach. So in case of gastrectomy, that is not possible. Okay, and the person is having dumping syndrome. Here, what is dumping syndrome? It is the syndrome or condition which is characterized by the person is having weakness, dizziness, and sweating after meal. Okay, after meal, and this is found in patients of partial or total gastrectomy. Okay, gastrectomy, partial or total gastrectomy. Okay, what are the causes for symptom? Because as I told you, there is hyperglycemia followed by hypoglycemia. And why? Because the person is having hypertonic meal, which is going directly from esophagus into the intestine. Okay, so those are the effects. Okay, and how can it be treated? How can it be prevented, this dumping syndrome? Those patients are advised to take small and dry food. Okay, milk and carbohydrates are avoided. Milk and carbohydrates are avoided, and dietary fibers are added. Dietary fibers are added. Iron supplement and vitamin B12 supplements are given, because they are not absorbed in absence of HCl, and parietal cells intrinsic factor is also not present. Okay, so these are all the consequences of gastrectomy. Nowadays commonly these bariatric surgeries are performed, and all these are the consequences of bariatric surgery. So rather than going for this bariatric surgery, we should go for healthy lifestyle. So we need not require this kind of bariatric surgery or this kind of supportive treatments to decrease the weight. Okay, fine. So this is all about today's class. Thank you so much. If you wish to get soft copies of all my notes, you can download the application Vesalius and subscribe. And if you wish to get hard copy, my book Physiology notes is also available on Flipkart as well as Amazon. Link for all that is given in the description box, as well as you can join us on WhatsApp. My WhatsApp number is 78638226668. And link for the WhatsApp group joining, that is also given in the description box. Thank you so much. If you like my video, you can like it, you can share with all your friends, and you can subscribe our channel. Thank you.